Welcome to session 3 in our series on infant and early mental health. My name is Chaya Kulkarni, and I'm the Director of Infant and Early Mental Health Promotion at the Hospital for Sick Children. I'm joined by Dr. Susan Dundas and Mary Rella, and today we're going to explore a little bit more about trauma in young children, and specifically those who are coming into care. In session 1, I talked about, what early development looks like, what kids need, how children thrive and develop. In session 2, we talked a little bit more about what trauma looks like for young children who come into care. And now we're going to get into more of the strategies and the caregiving behaviors that young children who do come into a caregiving situation outside of their home are going to need in order to feel emotionally supported and hopefully to recover from whatever trauma they may have experienced. So today, we know that for any child, even a little baby who comes into care, there is trauma when they're removed from their mom. And I'm even thinking about the babies who are apprehended right at birth at a hospital, who may not see their moms right away at all, but there is trauma for that baby who is separated from their mom so early. So I want to talk about what kind of caregiving behaviors become important for these kids who are in these situations. So Susan, I wonder if you can start us off. Sometimes a young child who's lived in an environment that is anything but predictable, maybe even, very chaotic, they develop behaviors that almost appear to reject the caregiving gestures of the caregiver whose home they've been placed in. What should a caregiver do in this kind of a situation where the child is literally maybe even pushing them away or simply not responding at all?
So a number of things come to mind, Chaya. We talked a little bit about how the parts of the brain are kind of in opposite directions when you have something that is frightening for a child who's had an unpredictable environment. So they would normally want to reach out to their caregiver and get mitigated, help that frightening experience calm down in their brain so that they could be regulated and come back to a typical functional social situation. When they've come from an environment where the very persons who are supposed to regulate them are dysregulating, unpredictable, or even scary, their brain doesn't know what to do. The natural instinct to go closer to the caregiver is thwarted, essentially. And the part of the brain that's engaged in the fight-flight and the one that wants to connect to the caregiver to protect them from the fight-flight, it's the same person, so they don't know what to do. So you're going to get caregivers who have these children in their own care receiving very confusing messages from these kids because it would appear to them that the child needs something, and yet they are pushing them away. So this very confusing set of messages. And part of what I would suggest to a caregiver is to, first of all, slow down, to take a moment, take a breath, be curious in their own brain about what this child might be needing as opposed to what they're doing. And then begin to be curious about how to help them with that need rather than responding to the rejection that's coming their way. If you know that a lot of kids who come into care are going to be responding in this confusing way, and you're a foster parent and you're going to receive kids who have these unpredictable messages, you want to take a breath, slow down, and think of it as a parent what a child might need at that moment and respond from that position of curiosity without being too intrusive, because you're going to get more of the pushback, because intimacy equally can cause triggers in children who have had intimate relationships that have hurt them. So we have to be really careful to go into the neutral a little bit, take some breaths, figure yourself out so that you're in that calm place and you're responding from the typical parenting instincts that you have and not from what is coming at you from the baby.
That would be hard work. Mm-hmm. It would be hard.
It's hard work.
Yeah. So Susan, when you describe this process that you're encouraging foster parents or customary caregivers to experience of calming down, catching their breath, stepping back, it sounds overwhelming. And I'm just thinking we've spent a lot of time talking about what kids need, what the babies need or the toddlers need. But we probably need to think as well about what the caregiver needs and where can they get some support in that situation to help them through that hard work.
Ideally, they can help. Foster parents are best off helping each other. I mean, I worked in a group of foster care treatment home where a bunch of foster parents came together on about a monthly or every 6-week basis. And I learned so much from them, listening to them talk about their children each time without really knowing the names of the kids. They would talk about their experiences with their children at different ages. And they supported each other in their situations and in how it felt to have a child move on or have the frustrations of not knowing what's next for their children and being able to talk about their own experiences of feeling helpless at times. And I think they helped each other far more than the professionals helped them, or I helped them at that point. And I think it was really, really good for them. So each other is a good place to go. And I think also if there is more family members who can be part of the system that their children are in, if they can teach their other family members a little bit about their children. And I worked with an adoptive parent of 2 kids today, and she's done a really great job in informing all of her family. She's got a big family, and she's informed all of her family members about what is FASD, what is autism, because she has a child with each, how their behavior makes sense based on their diagnoses, how their challenges make sense, and how the other members of the family can respond to them and help, rather than leaving them in the dark, not knowing and then judging the children and their own parenting of these children. So she's done a fantastic job engaging the family in being helpers as well.
It also makes me think, though, that for families where there is that kind of a diagnosis or potential diagnosis with FASD, we may not diagnose till later, but if we know that the child has been exposed, even to just do a bit of reading, get a little bit of information about that particular diagnosis and what that might mean and what that might look like could also be really helpful, because otherwise I think there's a real risk of almost feeling rejected by the child because you keep trying and working so hard.
Yeah. I also think that, for foster caregivers or customary caregivers, we spend a lot of time talking about attunement, talking about, the right thing to do and how to do it. And there's a lot of that. And I think giving space to, negative emotions that they experience is also extremely important. Sort of what I call, what are the deal breakers? What are some of the things that happen in the family that have you, think about and experience that is such a deal breaker. I remember talking to this one family. The deal breaker was that the child had trimmed the whiskers on the cat, and that was this child had been through had done other things, but that to the caregiver was such a deal breaker. And just giving them space to talk about the things that are just that hard. And it is hard to be attuned to, a child who's making it feel like you're ineffective and not necessarily, doing, the right thing. And by the way, we have some research that tells us that even though the experience, the inner world of the child is changing when it comes to security, that I might be seeing you, caregiver, differently in a way that has me support and be more connected to the relationship, my behaviors might still look exactly the same. So even though some shifts and changes might be happening to me internally, my behaviors look exactly the same. And sometimes we have to remind caregivers that it may look like nothing's changing, But the consistency, the predictability, the structure, the routine, all of these amazing protective factors are causing changes. They're just not necessarily like, billboard changes.
Right.
Yeah.
Right. Well, and that really beautifully takes me to the next question I had for you, which was really about the importance of consistency and persistence. Because when we talk about these changes that are happening on the inside, I mean, Susan, you've talked a bit about the brain and how the brain is developing, and I talk a bit about that in session 1. And I'm thinking, like, there's a really good example of where we don't see the changes happening, but we know from science that every interaction is changing the shape of that little one's brain, right? And we don't see it, and it might take lots of different connections being made before we see something on the outside happen. So Miriam, I wonder if you can talk, and you've certainly alluded to it, but the importance of that consistency, predictability, but the third thing is persistence, right? And knowing not to give, like having faith and not giving up because you're not getting anything back.
Yeah, and that's hard. Like the consistency and predictability. Like when we think about trust, we think about, well, what is it that allows for trust to develop? It's not like it is or it's not there. Yeah. In our life, we choose people to be connected with. And, well, how do we evaluate trust? Well, if you are predictable, consistent, and reliable, then I begin to trust you. And so those are probably 3 things that may not have been consistent in that child's life. So in a home where you have predictable routines, predictable structures, and what I mean is not like regimented. I don't mean inflexible routines and inflexible structures, but things that can, be navigated, but still what's consistent. This is a safe home. There's no violence in this home. What's predictable, that when it looks like you're in distress, I'm going to be available and attuned to you. What is reliable, that I'm going to be here day in and day out. I'm going to be here, and that's something that's going to be important in our relationship. That form of consistency serves to be such an important protective factor. And interest in you. I'm interested in you. I'm interested in what's going on in your inner world. I'm not just interested in the outcome of what's happening, but I'm actually interested in how you're putting some things together. So, a smile, like, like the idea that, when the child comes in the door, there's this, you look like it was a rough go at that visit. Looks like, I actually know that your mom didn't show up. That sucks. Just to be able to narrate that experience becomes one in which the child feels understood. Doesn't mean that they're going to be like, oh, I'm so glad you understand. They might still throw their backpack on the ground, or, might still shove past you and go up and be alone with it. But those first 3 seconds, they got the message of, I understand you.
Right. And 3 seconds, but it's big. It is actually a big deal. I remember working with a little one who, because another experience for these little kids is pickups. Different driver on the way to a visit, yet a different driver on the way home from a visit. And this one little one who really struggled with that. And we literally had to create like a picture board to create some sense of predictability that somebody was going to come in a car. This was where they were going to go. And it was hard work. But she needed that predictability. She would go to sick kids because she was getting treatment there. And there were all these doctors, and they were literally treating her from the hallway because, and again, just trying to create, where are you going? What can you expect there? And I'm going to be there with you the whole time. But that sense of predictability becomes so important for these little kids. And it's hard, right? Because you can't predict who the driver's going to be tomorrow.
Right.
right? So that becomes really hard. Susan, we've talked about how challenging it can be to recognize trauma in a young child. Talk a little bit about compassion and understanding for these little kids, because I think this can be challenging for a caregiver to get to that place, especially if they're being presented with a lot of rejecting and hostile and difficult behaviors. But compassion seems to be something that might be an important piece.
I like that word, compassion, and I use it a lot when I'm working with clients to develop a sense of compassion is the key. Even in my psychiatric consultations with clients, a big goal for me is to all together, the caregivers, myself, the babies or children, adolescents even, we work together to develop that sense of compassion, to understand where is this coming from. So I use a couple of questions that they can take away with them. Why is this behavior happening? And why is it happening now? And I suggest to parents and to the clients, if they're old enough, to be really curious about those two questions. So the why this behavior is happening is connected to their story. So a particular story goes along with this behavior. And I mean, one of the most confusing ones I got presented with was a 13-year-old who had stuck needles all into her body. They're just pins, like safe, the kind you use for sewing. Oh, she was sitting there, she was happy and right as rain, and they'd found them. They'd found them on X-ray. And I think one of them there wasn't any obvious distress. She was going off to get them taken out after the meeting. And they wanted me to figure out why she did this. And I was like, I'm going to go back to the beginning. And I said, what I usually do is find out about the story to the best of my ability. I'm going to find out about this kid's story. What do we know? Because we don't know much sometimes, but sometimes it's enough. What do we know? And in this child's case, she was preemie. So she spent her first few months in the NICU. And what happens in the NICU? So we get stuck with a lot of needles, and we get pretty isolated a lot of the time. We don't have a lot of caregiving that doesn't involve pain and discomfort. And this little one went from the NICU to her bio parent, and there was physical abuse. Went from there to another foster care situation where there was also abuse, unfortunately, and finally got to this current foster care. And what I was talked to about is that this is a really great placement. This is going very well. There's no abuse. She loves the parent. And why now, right, is a good question. That's the next question. I said, with that history, we can see that her whole life has been pain in connection with caregiving. So this is a connection her brain has made. There is none of that happening in her current relationship. But weirdly enough, she got a foster parent who had diabetes and had to inject himself with needles and take pinpricks and do all that. And I said, I'm not going to make too much out of this, but curiously, do we really now not know why she has decided to stick needles in her body? She's not any longer getting pain in her caregiving situation. And she was triggered by these needles and pins that were sticking in this guy's body. And although it might have been a very infant, pre-birth age baby that experienced all of that, her brain went right back to that. And she was happy with this experience. This was not a negative experience for her. So, when we look at that, there's usually a really good reason, and we can become compassionate. And then we all sat there together, well, what do we do about it? And I said, well, we have a sense of why it's there, and what we're going to do about it is another whole story. But it's not crazy. It's coming from a place of real brain developmental direction. Mm-hmm. These symptoms are there for a reason. Why this? Why now? And every time you feel like you're stuck a bit, go back to this. Why is this showing up right now? No reason at all. And then halfway through the session, you find out they had an encounter with a past family member, or they ran into so-and-so, or the kid will tell you, best one ever, 9-year-old. She sat and listened to this whole conversation we just had, not with the other client in it, but why this, why now? And she's sitting there quiet, and the caregivers and the teachers and everybody's all looking at each other. We don't know why. We don't know why. She was stealing all the time. Stealing. And stealing is connected to neglect. And she put up her hand. She said, I know why. And I said, oh, okay. That's even better. You tell us why. And she said, because my teacher is going on maternity leave. So she had developed this beautiful relationship with her art teacher. And and she was stealing her art teacher's art supplies. And her foster mother was like, she has all these art supplies at home. She has exactly these same things at home. But right away she put up her hand and said, because she's going on maternity leave. And it was like, okay, my job is done. You guys do the rest now. So because at this point, you know what to do. You know that there's going to be a goodbye. You know that she's connected. And there's ways in which teachers keep connected to their kids. They send pictures of the baby to the school. They tell everybody in a note, they're coming back. There could be a, little special message for her. And, there could be ways in which they can consistently produce a sense of connection. And then the teacher will come back and maybe she'll have a chance to say hi to her again. So there was something to do. But early neglect goes along with stealing, lying, but particular kinds of lies that are about self-aggrandizement. So bringing oneself up in the world, a sense of, they go to school and say, I have a brother who's got cancer and he's dying. And meanwhile, everybody in the whole class knows she doesn't have a brother, let alone a brother with cancer who's dying. And why are they telling these lies? And we have to look at the neglect. When I hear that, also enuresis, encopresis, but the stealing and lying are what gets people because they want to punish these kids for this. They want to hold them accountable. Right. And what I want to do is wonder, why now?
And
why
that's the compassion, right? Because you have to be open to the fact that there is a story there, and it's probably a tough story, right? Because I've also heard caregivers say, they're in a good home now, they should be grateful. It's not that simple for these kids. Okay. Mary, often the new caregiver can be a mitigator, right? To help the child manage their experiences and their emotions. Can you describe this as a strategy that caregivers should keep in mind?
Yeah, so what happens is that, as we've talked about, early experiences have been experienced in potentially threatening kinds of ways. So now there's an opportunity to have similar experiences with the buffer of a caregiver who can help to experience the same or similar experience in a different way. So there's an opportunity to mitigate the experience. So for example, frustration met with understanding of, gee, that behavior, that, the reason you're acting this way is because your homework got really criticized by your teacher, and that makes it feel really awful because you tried really hard to make it right, and that didn't go well. As opposed to, well, you didn't do your homework, you left it to the last minute, you rushed it through, and that's why you did a bad job. So, an experience can be understood, even if it might even be for the exact same reason. Mm-hmm. But the experience of frustration can be mitigated or understood differently by a foster caregiver or a caregiver who can help the child understand that this feeling that they're having actually now makes sense for them. What really happened is that the teacher got mad at them and that made them feel embarrassed. And that is a terrible feeling to have. And that's why they got into trouble at school and were sent to, the principal's office. And the foster caregiver had to get there and go, right? So it's the mitigated experience that, you know, a caregiver can provide. It's the same experience, but I'm going to help you experience it in a different kind of a way. And the only thing that's going to be really important is that you're not alone in it.
But that also requires compassion then.
Yeah.
Right? To be the mitigator means you have to be prepared to really understand what that child has experienced. And it makes me think of a situation up north with a little guy who's definitely struggling, may end up with a diagnosis of some sort. And the solution was to create an isolated workspace for him. He's in kindergarten. I'm not sure we would create an isolated workspace for any child in kindergarten, much less a child who's going to end up with any kind of a diagnosis. And when I started to probe, what started to come out was what he really loved was being on the land, drumming, right? And so, you know, to be able to understand what being in an isolated, confined space was actually making what he was feeling even worse. And to be able to see that for him, this was a connection when he's out on the land or when he is drumming. Like, so it really does require a level of compassion and to realize that can be a really effective strategy. And because not only does it help the foster parent understand, it helps the child understand as well, right? And legitimizes their feelings.
Full circle. Support is needed, a place to go and get support for, so that you can't do this day in and day out.
Right.
And, you know, feel like, oh yeah, it's a no-brainer. It's like, it's a full brainer.
It is a full brainer, yeah.
It's a lot of work.
The next question is a little bit tough. And sometimes, and we've seen this in research, that in foster caregiving, because children can sometimes present with alienating or rejecting behaviors, sometimes the caregivers respond in kind, right? So I wonder, Susan, if you can start us off on understanding this, and, you know, how do we encourage caregivers to, especially with the really little kids, right? Not effective.
The research does show, that the attachment research, that kids with disorganized attachment, so the kind of attachment that is not the usual attachment of about 90% of the population. So kids who don't, respond in the typical way can actually shift the attachment of the adults, which is usually the other way around. The adult helps the child develop an attachment style. The other way around can happen with kids who have this disorganized style. So it's a pretty tricky situation, because caregivers who feel helpless and hopeless, that in itself is traumatizing. So there can be some burnout. And if you feel like you're not doing a great job, you can start to dislike the client. And even if especially if they're doing something that feels harmful to you or your own other kids or the other foster children or the animals in the home, that can start to feel very much alienating for the caregiver. And they can get to the point where they start to feel feelings of dislike, which doesn't feel good for a really good caregiver to have those feelings. So it becomes quite difficult sometimes for those caregivers. And I think part of the tricky bit is being able to stay in a place where they feel helpless about knowing the right thing to do, be able to share that with either the workers that they're involved with or the therapists that they're involved with, that I really don't know what to do. I sometimes feel helpless. And to join, to get the compassion from those workers that they can then pass on to the child, because what they're experiencing is what the child's experiencing about their life. Helplessness and hopelessness. And that's a really hard place to live. One time I was in a consult with foster parents, and CAS workers were there and the therapists were there, all of them. And they were facing a situation where they all were so frustrated with the court system. The CAS workers, everybody was frustrated because the decision that was coming down from the judges were not what they hoped for. And they all felt very helpless and hopeless about the situation and didn't know what to do. And they were searching, I think, in this consult for me to come up with something magic, I don't know, to change the judge's mind or something. I wasn't even involved in this part of it. But what we talked about instead was their feelings of helplessness and hopelessness, and how important it was for them to acknowledge that to themselves and then to these kids. Because these kids are in the system for a long time sometimes, and to be able to acknowledge within themselves that this is really confusing, frustrating, and it doesn't always work out in the direction it should. And to be able to express that and be with the child in that feeling rather than just getting angry at the system and fighting it and telling the child this is what should be happening, that they can join in that moment. This must be really hard. This feels really hard to be in this confusing state.
So I'm that makes a lot of sense. And now I'm thinking about the parent who's just not in a good place with the child and starting to feel angry. Can we apply the same strategy to say, I'm having a hard time with this, right? I need to go and get some, like, it's a lot of it is, is it okay to talk about your own emotions with these little ones who are struggling so much with their own emotions?
I think that it's a bit tricky, that one.
Yeah.
Because for some young kids, they've been part of the dynamic with their caregiver, might have been one where they were put in a situation where it's a role reversal. So rather than, you parent regulate me and help me understand what's going on in the world, you've actually given me that job. So I have to stay as regulated as possible so that then you can be regulated. So a caregiver who, in a situation where a foster caregiver is now, in a place where they want a role model, that actually sometimes coming back to a place of calm takes time. It doesn't just happen like that. It takes time. So the best way to be able to do that is to, give foster caregivers strategies where it's not like I got to go now and cool off because, but to identify that being calm in a situation or calmer in a situation is probably a really good idea. And so I'm going to go and take, 5 minutes and I'm going to come back, because my rule with foster parents are, if you take a break, you have to be able to say, I'm going to be back in 5 minutes and I'm setting the timer or something, like, so that there's a predictable place, right back to that predictability. I'm not just going and I'm going to leave you here high and dry. I'm going to go and I'm going to come back. But, I'm going to go and take some time to get calm, and I'm going to take deep breaths when I'm getting calm, and then I'm going to come back and we're going to figure this out again. Or like just something that allows for like narrate the experience you're having.
Which is what I was trying to say is that, like, that feels like that's one strategy for foster parents. And the other thing I like about what you just were talking about is it avoids the trap of punishment, because that's the other place to go, right? So in the example you gave us, the foster parent took the time out. So tempting to give the time out to the child, right? But compassion, if we can get to that place of remembering what the child's been through, that there is a story there, and take the time out to calm down, that is going to be more helpful in the long run.
I've said before that, I really think that compassion is shame's best friend. Compassion shows up when, shame shows up and goes, you did this bad, you're a bad person, you're not lovable, you're a horrible person. And compassion comes in and says, well, wait up a sec. Not true. Let's understand better where this is coming from. So compassion can help both the foster parents shame at some of the things that you're talking about around, I don't like myself in this relationship, let alone I don't like this kid, but can also come into play with also role modeling compassion for self-loathing and blame and that sort of those horrible feelings.
So it also seems to me, as just bringing this conversation to a close, reflection becomes really important for caregivers, being able to reflect and think about what they've experienced in the moment with the kids. And I want to acknowledge that, for caregivers, this can be trauma too. And it may be trauma on top of some of their own trauma. And so coming back to the importance of them seeking support, getting some help for themselves when they feel they need it. Any last words that you would share in terms of the caregiving kids need little kids, especially when they come into care? I mean, we've talked a lot about compassion. We've talked a lot about predictability, consistency, being calm. It's like a little checklist, right? But in the sense of just things to think about when you're in that moment.
I think not feeling like they have to solve the child's whole life. Right. That's a really tricky one, but join them in the darkness for a while so they're not alone. This is a really awful place that you're sitting in right now. You don't know what's coming up next, and you've been through all that. And even I don't have the answers for you, and the worker doesn't seem to have the answers for you yet. This is a really hard place to live. This is a hard place to be. I'm happy to be here with you for now, but it must be so hard. So to join them and not feel they have to rage at the system, or because that's not going to be that helpful, but to live in that moment. And one last quick story was this 5-year-old who, she was very sweet. She loved her new caregiver. And I'm trying to remember if it was an adoptive home or a foster home, but it was an open situation. So the mom was involved, bio mom was involved. It was one of the cases where it worked really well. The bio mom stayed involved all throughout, I think it was adoptive. And they had a great relationship, and mom would come into the family for birthdays and things, and she loved the adoptive mom and the family there. She loved it. She loved her mom, her bio mom, a lot. And she felt this massive, so everything was working well. The CIS workers had done a great job. Everybody had done a great job. The therapist, the parent, the bio mom, everybody was doing a fantastic job. And as this kid was talking about loving foster mom and loving bio mom, her head just went down like this. How guilty she felt about both, because she wanted to, and she just landed on the table like that, like the weight of the world on her shoulders. Because even though it was a really ideal situation,
Still tough.
it was still tough, because she's in this conflict between feeling like if she loves her adoptive mom, she can't be with her bio mom, and if she's loves her bio mom, she can't stay with her adoptive. So she was in this tremendous, terrible feeling. So even when everything is going perfectly, the situations are really hard. And we can't take that away from them. That's their life. So even if we do it all right, we may not be able to protect them 100%. But it's a whole lot better than if we don't do it all right. And they can work those pieces out.
Yeah.
And be alone in it.
And be alone in it.
Be alone in it.
And recognize that it's messy.
Yeah.
I often say to people, infant and early mental health, it is messy work, and it involves a lot of heavy lifting on everybody's part.
Little kids rupture all the time.
They do.
It doesn't take a lot for a little kid to fall apart.
Yeah.
And so it's okay to be able to expect that happens a lot and a lot and a lot. And so when you've got a child who comes in and you're going to help them mitigate those ruptures by offering repair, that is the mitigation. That's the thing that never happened before.
Yeah.
Only the ruptures happen, not the repair.
Not the repair.
So now in foster home, there's a ton of opportunities for repair. And the more ruptures you get, the luckier you are as a foster parent, because the more repairs you get to do.
Oh, that's interesting. That's such a positive way to look at it. Wow, this has been great. Thank you so much for sharing all of your experiences and your expertise in this area. So that brings us to the end of our third session. Thank you, Susan, and thank you, Mary, for joining us.
Thank you, Chaya.